This is our third of our four-part Women in Medicine series that's hosted by New York ACP. My name is Vasundhara Singh. I'm an internal medicine hospitalist at Mount Sinai West, and I also serve as a counselor for the Manhattan region for New York ACP. My co-conspirator, who can wave at you, is Danielle Cochin, and the two of us have been directed by the chair for the early career physicians, Dr. Gambhir, who's here, and Dr. Kaul, who probably will join us later, to organize this longitudinal series, really, and it has been a pleasure so far. So if you missed the first couple, they're available on the New York ACP website. You can go back and look at them. The first was to do with mentorship, the second with actually visas and contract negotiation, and today we will be talking about leadership opportunities for women in medicine. I am very excited to welcome our three panelists, Dr. Gooden, Dr. Khan, and Dr. Lee. Dr. Gooden is a primary care physician and hospitalist at NYU Langone. She recently transitioned to her new role as a physician advisor at the Long Island Community Hospital, involved with utilization management, regulatory compliance, CDI, and quality improvement. Dr. Khan is a medical director at Pfizer and the chief medical officer for Apex Health, focusing on long-term care. She was one of us. She was an attending physician at Hackensack University Medical Center and Northwell Health before making this transition to pharma. And last but by no means the least, Dr. Lee is professor of medicine and medical director at Stony Brook. She serves as Deputy Chief Medical Information Officer at Stony Brook and is the governor for the Long Island District of New York ACP. So people will continue to trickle in, but we'll get started. And I'm going to have our three panelists talk to us about both their current, but also their past leadership roles. But more importantly, what they perceive as their own journey in medicine and as leaders in medicine. So I'd like to start with Dr. Gooden, please.
Hi there. Hi, everyone. I'm so happy to be a part of this panel. Thank you for having me. So I'm a little bit new in terms of my leadership role, but I just want to give you like a background of where I started. So I attended UConn for medical school. I graduated in 2010. I did my residency at Montefiore. I was a primary care physician. I'm still a primary care physician on the East End of Long Island for about 11 years. During my initial, years of training, I was more concerned with getting more comfortable with, my role as a attending physician and taking care of patients and gaining experience. I've always been a member of ACP, but earlier on, I would attend conferences and for CME, but I never really took advantage of, everything that ACP had to offer, like the networking opportunities and all of those things that you can get from ACP. So a few years ago, I became a lot more active in New York ACP. I started joining some committees, such as the Early Career Physician Committee and the DEI Task Force, of which I'm currently the vice chair. And I also was elected as counselor for the Suffolk County region for the New York ACP recently. I've developed some really wonderful relationships through ACP, specifically Susan Lee, who's also on our panel today. Dr. Lee has really been a tremendous help. She's helped me in terms of, personal growth and career growth as well. And I'll talk a little bit more about some of the ways that she's been helpful. I basically I'm also certified as an ACP physician peer coach. In 2019, for my organization, I served on the Student Life Committee of the Faculty Council for NYU Grossman School of Medicine. I've also taken on some active roles in my community to promote healthcare improvement and equity. In 2021, I served as a member of Congressman Tom Suozzi's Physician Advisory Council. And I also was appointed to the Suffolk County Legislators Maternal Mortality and Morbidity Task Force in 2021. So in that role, we are basically a task force that advises and makes recommendations to the legislature. We're a task force that represents the different health systems on Long Island. We have representatives from Northwell, from Stony Brook, representatives of doulas and other people that are engaged in helping birthing, in healthcare for birthing individuals. So a lot of those roles have really kind of formed and allowed me to be more of an advocate for healthcare, for equity in healthcare. And then recently, you know, as I kind of went on my career journey, got to my 11th year of practice, I started thinking about, you know, what else could I do? How could I impact healthcare delivery in our community on a broader sense? So our health system acquired a new hospital, and I transitioned to a new role as a physician advisor at my new hospital. As a physician advisor, I basically act like a liaison in between the senior leadership and the clinical teams. I serve as a key member of the healthcare organization's leadership team. I'm charged with meeting the organizational goals and objectives for assuring that there's effective and efficient utilization of the healthcare services that we provide. So in my current role, I do a lot in terms of teaching, consulting. I also advise the care management team and the utilization review department, and also the hospital leadership. So I'm really an expert and sort of have to develop a lot of expertise in all matters that relate to physician practice patterns, denial management, documentation requirements, and governmental and private and payer regulations. So it's been an amazing journey, a lot of things that I've learned. I've been able to really interact with my colleagues. I've been involved as well in some quality improvement projects within our facility. So a lot of it has been very fulfilling to see, you know, the impact on the quality of care that's being provided. And I've really enjoyed it. And I'm glad that I get to, and it's a non-clinical role, but you really use your clinical knowledge quite extensively. And I've really just enjoyed it, and really, really happy to be able to share that with you.
That's absolutely tremendous, Dr. Gooden. I was taking furious notes because I was like, note to self, physician advisor would be a great gig in the future. Note to self, internists can advocate for maternal mortality in New York City and Long Island. And that we have this amazing physician coaching program in which you can both serve as a coach as well as a coachee. And so, you know, one of the tremendous benefits of coming to an evening like today is you get to know things you never knew existed. And simply by that coming into your knowledge, hopefully something changes the trajectory of your life in the next few years. Let me ask Dr. Khan the same question. Share your journey with us as a leader in medicine.
Sure, of course. First of all, thank you so much for having me. I'm actually a newer joinee of ACP. So I went to the conference last year and had the pleasure of meeting Harveer, Dr. Singh, Dr. Lee, and I was really drawn into how everybody in ACP, especially New York chapter, is so supportive. So I wanted to get involved with early career physician, and that's why I've been working with Dr. Gambhir, and it's been amazing. I think I've learned a lot, and now I feel sad that I wasted 8 years of my life not being in touch with ACP. But I did my medical school in Pakistan, and then I did my residency in internal medicine at Newark, New Jersey, and I did a hospice and palliative care fellowship at Sloan Kettering. So initially, as Dr. Singh had said, I was an attending physician at Hackensack, but started to get really involved in the quality committees, especially since I did a lot of pain management for cancer patients, and learned a little bit along the way about how to be a leader. But really, I think what jump-started the journey for me was I decided to get an MBA at Columbia, and that really helped me kind of see what was outside medicine that I was not exposed to earlier. So a lot of the business aspects of medicine came into light for me. I transitioned to Northwell just for personal reasons, nothing professional, but I was able to help them develop a program here in Staten Island for palliative care. And that was one of the first programs in one of their other hospital building that they had. Again, here also, I was involved in a lot of quality committee PNTs and pain medicine committees. And then I actually transitioned into pharmaceuticals. And the reason was that I was trying to have like an effect on a bigger scale. So I thought that maybe transition to pharma might be a little bit more helpful. And actually, my role here has been as a medical director. So I'm responsible for engaging with healthcare professionals and creating some content, which is, as a lot of people say, non-promotional, which means it's not sales, and trying to do advisory boards so that we can bring about transformational changes. So I partner a lot with healthcare professionals in this role. And in the meantime, I became the Chief Medical Officer of Apex Health. It's actually involved in post-acute and long-term care facilities. And most of their buildings that they work in are in Baltimore. So a lot of my role there is making sure that we're in compliance, sort of fostering innovation and teaching all the new physicians that join, and also policy development. So just some of the little things I'm doing along the way.
That is so exciting. And that really resonated with me, where you said, I really wanted to make an impact on a larger scale, and how you can take those hardcore skills of being a physician and then apply them in leadership and management, and really transition in a way that I couldn't have imagined within the first 10 years of your career. Is that right, Dr.
Yes.
Khan?
Yes.
That's tremendous. And Dr. Lee, if you can round out your
I don't know if I could
journey.
top these two. I'm like incredible stories. So I am a clinician, number one. I started at Stony Brook 26 years ago when my second son was 3 months old, and I started full clinical, and I wore many hats at Stony Brook. I started out, just doing full ambulatory clinical. And back then we didn't have hospitalists, so I also did a month of hospital service. And from there, I was assigned to be the firm chief, which is a really crappy job, actually, even though it was a leadership role. But I had to make the call schedule, and everyone would yell at you. And if somebody was out, you had to find coverage, et cetera, et cetera. But because of that, I learned how to manage and work with people. And as I got more interested in academics, I was asked to become the program director of a big medical school course called Introduction to Clinical Medicine. It's a course for first and second year medical students. I totally revamped that course, took it off paper, and I did something really innovative at that time. We had like the regular slides that you put in the carousel. I transposed all those slides into PowerPoints, and there was a lot of resistance, which is so funny, right? And I was considered like, what is she doing? She's taking all these slides, but I did it. And I rewrote the curriculum. So I did that for many years. And then from there, I was asked to become the associate program director for the combined medicine pediatrics residency program, which I did for many years as well. And then from there, I really thought about like, what's my passion? Well, my passion is about being a primary care physician. And I saw that it was such a hard job, and there's a lot of administrative burden, especially with, EMR had just started and such. And so I figured my passion was really to help primary care physicians to work smarter, not harder. And so I had an opportunity to get involved in patient-centered medical home. And I became the medical director of our large faculty practice and transformed our practice from a very reactional type practice into one that was a team-based primary care practice where we actually did a lot of good things. And then from there, I became involved in QI because that's tied to medical home. And I've always been interested in informatics and computers, even though I don't have a degree in that. And I was recently asked to be a deputy CMIO of our institution, which I think really ties into a lot of the ideas that I have about practicing medicine more efficiently, and with especially AI and everything that's going on. So it's very exciting. So I've worn a lot of different hats. And then lastly, probably the one that I most am proud of is that I never thought in a million years that I would ever be a governor of this chapter. And I would say to all of you that one of you might be governor one day. So if you have the passion and you want to be a leader, it's the best opportunity that you possibly could have in your career. So that's my story. I'm also Yelp elite, so if you want to look me up on Yelp, that's my leadership.
That's tremendous, and what really struck me was, 26 years ago when your son was 3 months old, because when I tell my story very often, I always say, my second son was 3 months old when the pandemic started. Like it's etched in my memory, having to leave that little baby. But the tremendous range you've had across your career, Dr. Lee. I mean, this is one of the privileges of being an internist is we get to have this width in our careers, and you truly have transcended any barrier one can imagine. You did some UME, and then you crossed over to GME, and then you crossed into major leadership, and the common theme.
ADHD too, probably. I get bored and then I'm like, but it's all good.
Yeah, but the common theme that struck out in your journey was the fact that you had your own interests, and then there was the need of your organization, and the alignment just leads to this great success and sort of the next step up. And I think that's the thing to remember is if you can find that alignment between your own passions and interests and what your organization needs, or what your extramural organizations, your other professional homes such as NYACP need from you. So thank you for sharing that. And let's go to the next thing we're hoping to discuss, which are the challenges. And we touched upon children briefly, but what are some common challenges that women in medicine face when we're transitioning from, perhaps a residency to your first job, or your first job to that second job, and how can we effectively navigate these challenges? Let me ask you, Camile, to walk us through. Yeah.
Sure. So as we know, women, despite the fact that there's a great percentage of women in medicine, and women are more represented in medicine now, we are still pretty much underrepresented when you look at positions in leadership. So that's the first barrier really that we encounter. And so you're in a position now where you don't see a lot of women that are doing the sort of things that you potentially could anticipate that you may want to do. So there's inequities that we face. Sometimes women can face microaggressions, they can face bias, sometimes women can even face harassment even within their organizations. Some organizations do not have the sort of support system in place that can be helpful in promoting leadership in women. Women often, may not have access to the same opportunities. They may not have access to the same mentors or the same sponsors that others do. And just to be clear, mentors and sponsors are so essential for us to be able to accomplish some of the goals that we want to accomplish. Women may also have competing interests and responsibilities, and we have children, we have demands from family life, that may be a little bit different than, say, a male physician would face. Not to, kind of downplay father's roles and everything. Everybody, works very hard, but of course, women traditionally have been more thought to be, the people that run the family or take care of the family. And in some families, that may still be the role that a woman physician would play. And that can also, create a little bit more stress. Women sometimes find themselves too, that they may be in roles where they're doing the work, but they're not really getting the professional advancement or the compensation that is warranted or deserved by the role that they're doing. So, what can we do? What can we do as women? So one thing that we can do is to seek out mentors and seek out sponsors. And as women leaders, we have to also be mentors and be sponsors to other women physicians and other physicians in general who are trying to advance or grow professionally. So as you know, a mentor is someone who is going to give guidance. They'll give you guidance, advice, and feedback. But you go a step further, and you're going to be a sponsor to another female physician. That means that you're actually going to take an active role in helping that physician to advance their career. You're going to do things that will help to improve their visibility or make sure that they have access to certain opportunities that you think they would maybe be a good fit for. You also can introduce them to other people in your network as a sponsor and say, you know, Dr. such and such seems to be a great match for such and such promotion, or to do this. Or, you know, a lot of times as women physicians, we have so many competing things that we may be doing. We may overcommit ourselves, but say you overcommit yourself, and then you know a fellow woman physician that may be able to fulfill that extra responsibility that you're not able to do. You know, so this is kind of thinking of it as looking backwards, you know, or helping each other up the ladder is what I should say. If you can visualize maybe a ladder and we're all trying to get there. You can get there, you know, alone, but you can get further if you go together. So if we kind of, you know, extend that helping hand to each other as mentors and sponsors, that can be very helpful. And for me, just to specifically talk about how this has been instrumental to me, Dr. Susan Lee, who's on this panel, recommended to me, you know, to apply for a women's to a program as a part of a cohort for the Women's Wellbeing Through Equity and Leadership program. It's a collaborative program that tries to engage a diverse group of mid-career and women physicians, and it helps in terms of networking, mentorship, training, and it's all surrounding wellness, equity, and leadership. And I applied for this program and actually got into this program, and it's a 24-month program running from 2024 to 2025, and it's been incredible. It's basically put on by the American Academy of Pediatrics and co-sponsored by a total of 10 organizations. So it's ACP and ACOG, American Medical Women's Association, American Psychiatric Association, National Medical Association, and a few others. And there are 3 scholars from each of these associations. And we had our kickoff meeting in Chicago in February. And we had a incredible, I mean, these women were just incredible, the things that they're doing. And I think the first thing is there's that representation, having that representation, being able to see women that were at different points along their leadership track and having them talk about it, talk about how they made it to that point, what's going on in their journey, what things they've found to be helpful, and then just kind of being in that environment to grow together has been amazing. And, you know, if it wasn't for Dr. Susan Lee, who's on this panel, I may not have even known that that program existed. So just, you know, encourage that as women, you know, we really need to be able to lend a helping hand to each other as physicians.
Personal stories really strike a deep chord. Thank you for sharing that, Dr. Gooden. You know, amongst the many things you mentioned, microaggressions and harassment, the access or the lack thereof of mentors and sponsors, for the people who actually run the family, or I might say run the world, is quite unfortunate. And the one thing I will say is, you know, you will find mentors and sponsors in various parts of your life. You'll find them within your institution. You'll find them within your alumni associations. You will find them in professional societies. And I think what we don't do enough is seek them out. I'm guilty of this. Very often I turn around and I say, what happened to that incredible mentor I had? And I realized, well, as a mentee, I didn't reach out enough. Yeah. The beauty of sponsorship, though, is that as long as you maintain your professional networks, you will find sponsors, and you will find them frequently and in abundance, especially in the field of medicine. Dr. Gambhir, for instance, right? He sponsored me to do the series, and here I am, and you know, everyone's like, "Oh, the series is going really well," and I was like, "Well, it's all to the credit of Dr. Gambhir." And so sponsorship is available in plenty. You just have to look for it.
Yeah. I think you're absolutely right. And it's also important to look within your organization to see if they have any sort of formal leadership tracks, because a lot of organizations will have that as well. Usually it's not advertised that much. I don't know why, but they do have it, and you really have to seek out what you need and what you want in life.
Yeah. I'm going to ask Dr. Khan to talk a little bit about what you consider to be skills or qualities that are essential for women in medicine to develop early in their careers to then become effective leaders. And as you think about that, Dr. Khan, I'm going to make a plug for an old video in which we have Dr. Darylyn Moyer talking about microaggressions. And it's beautiful. Dr. Lee's in that video also. And she really just talks about how all of us have experienced it and what we can do about it. It's on the NYACP website. Dr. Khan.
Well, thank you for telling me about that video. I didn't know, so I'm going to go back and watch it now. Because like I said, all of us face that. So going back to your question about early on in the career. So I think one thing is that I always tell any residents and fellows that I meet now to get involved with their organizations, if it's ACP or if it's family medicine or anything, to really involve with that, because I think one of the things maybe we don't do as residents and fellows when you're becoming an attending is developing a network and just getting to know people. So like I said, not even getting to know all of you amazing people in New York ACP, I felt like was a loss. And I think I've told this to Dr. Gambhir before also, but just being in your network and finding people who can help and support you. And I definitely have to second Dr. Gooden that mentorship and sponsorship is very, very important. And I think as women, I don't know about everybody, but maybe we have this imposter syndrome sometimes. We do feel that maybe we're not good enough, or maybe it's too early, but there are people, and gentlemen who are male doctors who might not think that it's too early for them, like they'll jump at the next opportunity. So I think having mentors that can kind of help you through that is helpful. And then the other thing is coaching. So I landed into coaching kind of later on, but I think it was the best thing that I ever did, because it helped. They kind of guide you. They're not just therapists, right? We all know that. They're different. They kind of coach you through how to be good at your role. And one thing that we really worked on was imposter syndrome, like just thinking that you're not good enough for something. And it can be something very minuscule that you think of that you can't do, but it might be that thing that's stopping you from moving on to the next step. So mentorship. And then third is also learning. So being very open. Just because we have finished fellowship or residency doesn't mean we know everything. So having your eyes and ears open for the hospital system that you're in, learning the ins and outs, okay, who's politically where, being involved in committees, especially quality committees, any of the P&T committees, just putting your face out there. I know it's a little bit of time constraint sometimes, because like Dr. Gooden said, we have so many competing interests, right? You have to go home also, but then you also want to work. So some sort of committee, just getting your face out there. So people in leadership know that, oh, this is a new doctor who has joined. So for example, I joined the P&T committee and I got to meet so many people in the pain management area, where I was then able to like work with them on a ketamine protocol, which had never been done before at Hackensack. So just as an example, it's important to get your face out there. And then advocating, not just for patients, but for yourself. Don't be, I think we all need to learn a little bit more confidence, and that really comes from coaching. So learning how to advocate for yourself and coming across in a powerful way, not in a rude way in any way. And then being flexible, things can obviously change along the way. Maybe the job is not how you had imagined it to be, but being adaptable, being able to change, but also standing your ground, which is really hard to do. You have to develop the skills for that, but know that what it is that you would want versus what the job also needs, because you have to kind of align your values with that.
That is fantastic. You gave us so much to think about. So become a part of organizations outside of your own. Right? So look for professional homes which are not your organization. Find a coach. And maybe Dr. Khan, you can tell us briefly on how you found your coach and how others like us can find coaches.
Yeah.
Raise your hand to be on a committee. Advocate for yourself and for your patients, and then be flexible as you're transitioning through this journey. I think something had struck out for me at one of our ACP meetings. Someone said, men, like you said, they jump at any opportunities. Women make sure that they fulfill every criteria before before they raise their hands for the same opportunity. And so just thinking
Yes.
about that a little bit, Dr. Khan, how do we find a coach?
Okay, so I actually found my coach through Pfizer, so sorry about that. But they actually had a program about women leaders, so I had applied for it, and that's how I got my coach. That was through BetterUp, but I know that there is a physician coaching, just like Dr. Gooden had done. There are physician coaches out there. There's actually an organization, and I can try to find the name while somebody else is answering the question and put it in the chat. It is a physician coaching program. There are a lot of physician coaches out there who can help. Or you can even find, if you like, somebody who's more of a business coach. So you have to also see when you find a coach, if you fit with the coach, right? It's not that every coach doesn't work for you. And then is it a business coach versus a career coach versus more of a physician coach? So those are like the different areas that you also have to kind of look at.
Yeah.
But I'll
yeah.
try to find the name of that organization.
Yeah, I've heard this a lot from my friends who've made that leap from medicine to business, that the business roles usually come with coaches. And only once they've had that coaching do they have these epiphanies of, oh my God, this was missing my whole life.
Yeah.
Dr.
Yeah.
Lee, with all of sort of your decades of experience across the spectrum of education and leadership, how can we as early career physicians or even as trainees start to identify a good mentor, start to identify who these sponsors could be? And do you believe in that, like it's very hip to say these days, like you need to have a board that's managing you, a board of mentors and sponsors?
Yeah. So Camile and Sunniya, you said so many things that resonate with me about mentors and sponsors, and you need mentors and sponsors to get into leadership positions, and I'm so thankful for the many that I've had. I would say the best way to find them is look at people in your community and your organization and say, like, is that somebody I want to grow up to be like, right? So when I was in medical school, there is, I don't know if any of you know Dr. Greco. He's an icon of NYACP, but he was, an attending when I was in medical school at NYU. And I was so impressed with him. He taught our Introduction to Clinical Medicine course, and he was the ultimate primary care physician. And he's actually the one that advised me to get involved in ACP. And then I looked up to him and said, this is like the kind of doctor I want to be. So I consider him to be one of my mentors. And so I've sought out people that I want to emulate or be like. In terms of sponsors, I would say that they sort of come to you organically. People recognize your skills and hard work. And for me, like, I love being a sponsor. Like, I feel like I did nothing by recommending Camile apply. I was just an email. Like I said, this is an amazing program. You should apply for it. You have all of the skills that are needed, the criteria to get this. And she got it, as did another one of our members from our chapter. So out of the 4 people that ACP, or 3 people ACP National sends to this program, 2 of them are from my chapter that I feel so incredibly proud. And but I really feel like I did nothing. All I did was just promote them. So I would say your sponsors and your mentors are around you, and you just need to ask. People in leadership remember how they got there, and we, especially women in medicine, I think we need to stop doing like elbowing out each other, but instead we should lift people up, because when we do that, you surround yourself with good people. We make the practice of medicine better, and it feels good when mentors and sponsors do that. So, just ask. There's no harm in asking. They're all around you, and not necessarily at where you work, right? I have mentors and sponsors, many that are not at the place where I work, but are in other organizations or in the community, and some may not even be physicians. So you just need to look and take a chance.
Yeah, that's just a beautiful sentiment. And I completely agree. Some of my favorite mentors and mentees are completely outside of my own organization, and I have sort of just organically met them at a meeting, met them through a common contact, who thought that we would be a great fit. And sort of that organic nature actually helps to keep that relationship going, rather than the more sort of
Like
deliberate
match,
forced.
right?
Yeah.
Forced match.
Yeah, but I think you hit the nail on the head. You need to ask. If you don't ask, it's not going to happen. And
And I find if you ask and you reach out, I would say that most of the time it works out just fine. You just have to have the courage and maybe like get the imposter syndrome out of your ear, that little thing that's whispering there, get it out of your ear. But you just need to ask.
That's a perfect segue. Let me ask Dr. Gooden, short of having a coach, right? Because only Dr. Khan has a coach. The imposter syndrome can be a significant barrier for many women in medicine. And what advice do you have? What have you sort of practiced on your own to overcome these feelings and to build the confidence that's required for leadership positions?
Well, as we know, imposter syndrome is experienced by about 25 to 30% of high achievers. And medicine, I guess we can put categorize ourselves as women as high achievers, because medicine as a arena is an achievement arena. It's all about what you've done, what you've accomplished. And this imposter syndrome is a psychological phenomenon. It really makes you doubt your abilities. It makes you doubt your achievements. It makes you doubt if you deserve to be where you are, or, so you'll be in a room and you're like, wow, there's a lot of smart people in this room. And it escapes you that, you know what, you are one of those smart people as well. So, it can lead to you questioning your competence, and it really has been linked to increased rates of burnout, increased suicidal thoughts. There was a survey that was done with Stanford Medicine, and they looked at 3,000 physicians nationwide. And what they found was that, a majority, like a lot of physicians, 25% to 30% of physicians did express symptoms of imposter syndrome. And, compared to the average worker, physicians really we do have high levels of resilience. We do have support in some instances, but we really don't seek those things. Like, we don't utilize it sometimes, or we think that maybe we should be able to take care of these needs on our own, and we don't seek the help that we need. So no matter what our accomplishments are, and no matter how much we've achieved, sometimes, physicians look at themselves and say, this is not good enough, or, how did I even get here? Somebody's going to realize that I'm really not that great of a doctor, or, did I get all of this by luck? And these are the kind of feelings that can plague us. And I think it happens with male physicians, it happens with women physicians as well. And it's something that yields no real positive results. It really can exacerbate feelings of being unwell. It can exacerbate burnout. It can really it increases the risk of even suicide, within our community. So it's a very, very serious thing. And how do we really make sure that we work to overcome this? So to overcome imposter syndrome, we need to increase the awareness of it, right? We need to increase the knowledge that it exists, and so that especially young physicians and medical students can understand that this is a real, condition that a lot of physicians face. No matter how many years in practice that they're in and how accomplished they are, they can tend to feel as if they don't belong. So one of the things that we need to focus on is that. Then we need to be able to acknowledge, that the expertise that we have, the accomplishments that we have, are due to our own personal effort, that it's not luck, it's not any combination of any other factors that are outside of us. It really has to do with your own effort, and that you really earned your place. You've really earned your place in your professional environment. Another thing that's important is for us to, as a medical profession, as a healthcare profession, we need to create support systems within our organization. So professional coach, individual coach, we need to have, committees, we need to have wellness committees, which we're having a lot more of those now, at least because we're putting more focus on physician well-being and wellness. And I think that those things have really helped to highlight this imposter syndrome, bring more notice to it, and give us more strategies that we can use to overcome it. The other thing that's important is for the physicians to not, as women physicians, don't compare yourself to others, because when you use comparison to others as a measure of your own self-worth, that really is excessive pressure. And that sort of excessive pressure a lot of times will, diminish your own personal worth and how you feel about yourself. The other thing I want to talk about, and it's important to seek, again, we've talked about mentors and sponsors all the time, because they're so important. They can help us to navigate these kind of issues as they arise and provide support and direction. Really just realizing that where you are, it's not by accident. It's because you truly deserve to be here, and you've earned the place, you've earned your spot, you've earned where you are in life.
That's incredible. I had no idea that imposter syndrome was associated with a higher risk of burnout and suicidality. That's actually quite appalling, and sort of your call to pay more attention to this, for trainees to be more aware of this, and even sort of leadership to be dedicating resources, including wellness, towards countering it. But I have a slightly different take, which I may offer to the audience based on a podcast I listened to recently, and I'm big on podcasts, I'll confess, curbsider junkie here, which is that back in the 1800s, there was a terminology called bicycle face. And bicycle face was described in medical literature as a woman riding a two-wheeled bicycle with clenched teeth and flushed cheeks and narrowed eyes. And that was bicycle face, and how that was, just like something is wrong with that woman. It's pretty hilarious, right? Like 150 years later, there's no such thing as bicycle face. You ride a bicycle, and that's how you look when you ride a bike. But to me, the pathologizing of it, the syndrome word, right? It makes the person think something is wrong with them. And so for me, like, I've discarded imposter syndrome as something that's not my problem. It's the perceiver's problem, like, because I don't have a syndrome. But to get to that stage, like, you have to go through the feelings that Dr. Gooden described. But I would like to offer this view of just like, it's not your problem.
That's an interesting perspective.
That's interesting.
Yeah.
Yeah, I mean, and I'm sure that in 100 years, women are going to look back at imposter syndrome and have the same reaction we're having to bicycle face.
I'm going to look that up later.
I think just either way, kind of really making sure that we foster that culture, that allows us to express our vulnerability, that we can have safe spaces where we can, express, personal stories, where we can kind of learn from each other. And it's important for us to be able to verbalize how we're feeling. Sometimes we don't want to say. I mean, I don't think I've met another physician who said, I have these feelings. And I know a lot of us do have these feelings. I've had these feelings of, I hope that, I think I'm smart, what I mean? But you always sort of can compare yourself to others, and then you kind of bring your own, and like, even being on this panel, like, look at these incredibly accomplished women, And so, yeah, I think we all kind of face it, whatever we want to characterize it as or classify it as. It's just important that we are having the conversations.
Absolutely. And vulnerability can be so powerful. I think the only time that I've developed strong bonds in my life is when I've made myself vulnerable to people. So there's more power in being vulnerable, which women are especially good at, fortunately. Dr. Khan, let me change the direction of the conversation a little bit, back to like other competing responsibilities. And how do you think women can balance the demands of a leadership role with their personal lives? And what strategies can help maintain this balance without compromising career goals?
Yeah, that's a super loaded question, but I love it. It's like what we do every day, but also for, I think, just any physician in general, right? I think we're all balancing so many demands, especially with cell phones, laptops, EHR. It's like, do we sign a note now or do I go to bed? I don't know. But no, this is actually a really great question. I think one thing that I've realized is very important is figuring out our values. Now, I know some people think it's a fad term, but a lot of it is like how you are internally, what your work ethic is, and how it goes along with your current job or the organization you're in. And I know there's, term like culture, every organization has a culture and stuff, but I think it does come into play. Say, for example, you're working with somebody who doesn't have the same work ethic as you. It's actually very hard to work, and then you start to develop certain feelings. So the most important thing is identifying those values and seeing how they fit into your personal and professional life. So you guys might have seen funny Instagram memes where people are like, I am a mom and I'm doing this and I'm doing that, and I'm doing this, and I'm basically surviving 24 hours. But I think if we know how our values are aligning at the end of the day, personally and professionally, it's very helpful to then direct your own goals. So then you are able to figure out, okay, what's my short-term goal and what's my long-term career goal? Of course, our goals can change, things can change, we have to be flexible, but at least you know in your mind, okay, this is what I want to do in the short term, what I want to do in the long term. So just as an example, I joined this company, Apex Health, because I do want to transition from Pfizer back into clinical, but also it allows me to use my leadership skills and develop those policies and figure out if you're in compliance, et cetera, with the government, because it's just something I like to do. And I've realized over time, for example, that I don't like to work for somebody. And this is a company where I am able to use my entrepreneurship skills. But it took me 8 years to figure that out. So hopefully we can all do that earlier in our careers. Another one is, I know we talk about effective time management, but I love calendars. So there's a new email app. So I'm really big into AI now. So there's this new email tool called Spark. And it actually, you have to pay for it, unfortunately, but it does prioritize your emails. And it actually helps you come up with answers through AI for your emails. So I love it because you can really see, like, it will put on top my work emails versus some silly ad that's coming, that's going to be at the bottom, and I can just delete it later. And it will help me figure out answers. So that's one. I haven't figured out a good calendar, but I do link my husband's into mine for Google, and I will put things on it in the family calendar so everybody can read it. So for example, on a Sunday, and I'm telling personal anecdotes just because this is how I kind of figured out how to balance all these things. So on a Sunday, either in the morning or evening, I'll actually go through the calendar for the week and figure out, okay, what my son has, what do I have work-wise, what does my husband have work-wise, and who can do what. So people are not stressed out or yelling at each other like, why wasn't this done? Why wasn't this done? Everything's not always going to run smoothly, but you kind of have to figure out that flow for the day, or at least the week, if not the month. Month, I think, is too far in advance for some people, especially my husband. He can't deal with it. Another one is outsourcing, because listen, we all can't do laundry and do dishes and all of that and be successful. I just have come to realize that as much as you would like to, it's just not possible. So we can outsource, and I know sometimes things can get a little expensive, but then you are able to focus on the important tasks, like being there for your family and also finishing your work on time, hopefully. So just before this, I was finishing my notes from the CMO thing that I have, only because I have somebody who's helping me with laundry. Otherwise, that's what I would be folding. So that's something that I've kind of realized after talking to friends. I know we've spoken a lot about mentorship. Of course, your mentor can help you, so I won't belabor that point again. I think Dr. Lee and Dr. Gooden have spoken really well about that. Another is having, I think, other female physicians in your network, and not just network, but being friends with them. So just bouncing off ideas with them, like, okay, what worked for you versus what works for somebody else, and just having that support system, even to talk to, is so helpful because it will help you kind of figure out your day to day. I know a lot of people talk about self-care, like, hey, we should work out. Sometimes we're not able to. So you could always put a little timer and every 1 hour, 2 hours, and walk like 10 steps. That's it. Like if nobody has time to get up and work out and go to the gym, which I really don't. So I do put that timer, or you can have your Fitbit or Apple Watch kind of vibrate and alert you, and then you get up and walk because it vibrates really hard. And then you're like, oh, I have to take my 10 steps or 20 steps, just something. Because a lot of time when we're sitting from the screens, we're also getting a lot of fatigue in our eyes. And I've noticed it's very helpful when you move away, that kind of helps you recover and go back to your task instead of getting more and more fatigued. What else? I wrote down some points actually, so I was just going through them. Another thing, like I already talked about, was coaching. And if you're the leader somewhere, then lead by example, I would say. Then I think people kind of follow you, your own team. If it's made of women or men, they see that you're managing your work-life balance and figuring it out. Last thing I do is I try not to use my phone at nighttime, which is very hard. But if you have that urge to respond to the email, please don't. And also, if you're sending an email at 10 p.m., I would try to deliver it so it doesn't reach that person at 10 p.m. It's reaching them in the morning. And actually, I don't know how many have seen Dr. Lee's signature. I love it. It says just because
Yeah,
like
mine says don't answer it because
yeah,
I'm guilty of answering email.
yeah. So you've written that like it's my
Yeah.
priority doesn't mean it's your priority or something like that. So that's really great. So those are just some examples that I have for trying to balance things.
I think, Dr. Khan, you touched upon every physician mom's sort of magic mantra, right? You've got to outsource. You've got to have a color-coded calendar.
Yes.
If you're the household manager, try to find someone who can manage your household, right? Someone who's organizing that, 4-person calendar for you. But I think the most relevant, which really struck a chord with me, is identify your own values, your goals, and your work ethic, and that frequent self-check-in. Maybe you're someone who wants to do that every month. Maybe you want to do it every year, but you have to do that self-check-in and say, like, what's really important to me at this stage of my life and my career, and then sort of color code that calendar following that introspection. And then Dr. Lee, I'm going to ask you the last question, and then hopefully we'll have a few minutes for our audience. And you do this day in and day out, which are, advocating for women to get more leadership opportunities, career advancement, whether it's within their own organizations or outside institutions. But how are some ways that the rest of us can do that for our, for people we would like to sponsor or we would like to mentor?
So I would say if you want to find leadership opportunities, the first thing is if something matches your passion, even if you think you're not going to be good at it, just say yes. Try, because even if it's not your bag or it doesn't work out, you can morph it into something that makes it your passion. I would say collaborate with others in different departments or people you don't work with, because that's another way to build your network and get your name out there. That's how I got involved in IT work at Stony Brook, was that, I became friends with this chief, what is he called? The IT guy, and then an opening came up. And so that's how I was asked to take that job. Say yes to speaking engagements such as this, something that gives me joy, I will say yes. Or if you can't do it, pass it along to somebody. But there's so many opportunities for leadership as long as you find the right sponsors and mentors. But don't say yes to everything. You want to choose the things that give you passion, because if you do good work in what gives you passion, you will have many, many leadership opportunities ahead of you. And I guarantee that. Whatever you do. And I also, as Dr. Khan mentioned, try and outsource stuff. Have a good partner that you share home responsibilities for. I think that's key. So what she had to say about time management really resonated with me. But I would say finding leadership opportunities at your institution or outside of work, they are there. And sometimes you just have to take a risk and say yes. and get rid of the imposter syndrome, saying you're not good enough, because that's not true.
Yeah, and I will say, I think say yes enthusiastically and often, and there will come a time where you'll say, oof, I've said yes too many times.
Yeah.
And, I mean,
Another thing I would say is that one of the reasons why I've been at my institution 26 years, it's not because of pay or power or anything like that, but I truly work with the best colleagues and allies I could ever imagine. And there are many people in my group that have worked there more than 15 years. And so when you're looking for a job or a position, you're also interviewing like everybody that's going to be in your professional family. So I'm very fortunate to work with a group like that. And I consider them my allies. We share information. We work together as a team. We lift each other up. And I would say personal advice is look at everyone that's working in that organization, because that's going to be, we're going to, you know, that's your second family, right? And family's really important.
I love that. And that's true. You're spending actually more than 50% of your life at work.
Exactly.
Very relevant. So let's open up to our audience if anyone has questions. We have 2 or 3 more minutes. If anything has really resonated with you, if you want to talk about a personal story or share something with us.
Hi, I'm Michelle. I'm a 4th-year medical student at Stony Brook, where Dr. Lee is. Just wanted to say thank you guys for speaking. Like, kind of what you guys were alluding to before, like sometimes you come on these calls and you don't even know certain things exist. I've been furiously taking notes on the side, you know, keeping things in mind as I get closer to residency. So I appreciate it. Just one question. I know you guys had alluded to a little bit before, like, you know, encouraging residents to like get involved in their, you know, committees and things like, or organizations and potential committees. Just wanted to know, like, for someone who is maybe like more junior on their career trajectory, if there's any other piece of advice you would give, maybe some hindsights you have now looking back, maybe on like the later years of medical school, earlier years of residency.
Dr. Lee, do you want to take that? Or you probably already mentored Michelle enough. So maybe Dr. Gooden or Dr.
We were
Collins.
texting in this little chat, and I was like, you need to email me. Let's get together for coffee. But, you know, just reach out to your attendings. You know, we love medical students. We feel very energized by them. Get involved in local chapter. We love giving advice. Come to our local chapter events. And I think it's really smart that you're involved in ACP as a medical student. It will give you many rewards. I know that when I lived in New Jersey and I moved there for 3 years, that, you know, that was my local, I could always find the chapter, like Ankita Sagar. She moved to New Jersey and we were very upset with her, but she found a new home at New Jersey ACP, and they have fully embraced her, although we want to steal her back. But yeah, there are many, many opportunities through our chapter.
Absolutely. I just want to kind of echo what Dr. Lee is saying. You really want to try to just don't get so bogged down with all the hard work and all the study, and just kind of find other things that you're interested in. It doesn't even have to be exactly, you know, clinical care. It could be some other aspect of medicine. It could be advocacy for some, you know, some medical condition or something else that in your community that's going on that you want to be involved in. Realize that you're going to be a physician. You're almost a physician. You're a student physician right now. So you have a voice and people want to hear your voice. Actually, you know, you're considered an expert in certain areas, and you know, you can really help people. Sometimes people just want someone to listen to them as well. So there's a lot of ways that you can have a positive impact. And for me, it's really just getting out there. You know, if you see something that you're interested in, if there's something that you can sign up for, take the opportunity. Because honestly, you know, if you want to change or or do something interesting. You have to be able to take the risk. A lot of times we try to say we don't want to fail, but in order to really, really advance, you have to take risks. You have to take risks. You have to run the risk of failing at something in order to accomplish something great. So I think, you know, just kind of throw everything to the wind. If you find something you're interested in, go for it.
I will just say very quickly, Michelle, there is definitely actual positions for students within medical schools on committees, you know, whether it's the admissions committee, the promotions committee, executive oversight committees. There's so many committees on which students are highly valued, and we beg for them to show up, especially here at Sinai. We say, oh, please show up to these committees so we actually find out the impact of our work, right? We want to hear from students and we want to hear their voices. And that looks great on your CV when it comes to applying for residency, the committees you've served on. And exactly like Dr. Lee said, the medical student committee at New York ACP has lots of students. Amongst the students, they're student leaders. And so that's another really great platform. And I'm sure, like, as you start looking and asking, as has been suggested several times this evening, you'll notice these opportunities mushrooming up everywhere.
No, thank you so much for that. And actually, one of my current mentors at school connected me with Dr. Lee, who just got me onto the medical student committee. So I'm excited for a good year. So thank you.
It's an amazing committee. The medical students do such great work for our chapter.
Yeah, I'm looking forward to it.
Fantastic. We are slightly beyond the hour. I know, Augustina, you turned on your camera. Did you have a question?
No, I just wanted to thank everybody. I think it's very interesting to hear everybody's pathways to where they got. So I felt kind of very inspired by that. So thank you. It's very nice to meet you all.
Oh, thank you.
Thank you. Thank you so much.
Thank you.
Thank you.
Dr. Khan, Dr. Lee, and Dr. Gooden, thank you for spending an hour with New York ACP this evening. Our fourth and final hour for the Women in Medicine series is actually at the annual meeting. Loretta, October
26th.
26th. Thank you. In
beautiful
Tarrytown.
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 Yeah.
Okay.